Have you ever taken an antibiotic for a simple cold or stopped taking medicines halfway because you feel better? What if I tell you that these small actions can slowly make medicine stop working altogether? Today's discussion is about a silent but dangerous public health crisis: antimicrobial resistance, commonly known as AMR. I'm Dr. Nisha Jacob, presenting on behalf of Career Guidance and Adolescent Counseling Cell, Alapura. This video is based on an article titled "Fine Tune the Signal to Sharpen India's AMR Battle." It's written by Ramya Kannan, who is a senior health journalist of The Hindu. She has extensively reported on public health, infectious diseases, and health policy and governance. Her writing is known for translating the complex medical issues into clear public understanding. So, this article is important for all of us. The article begins with a serious warning. Antimicrobial resistance happens when bacteria, viruses, or fungi stop responding to medicine meant to kill them. This means that common infections become deadly, surgeries become risky, and treatments become expensive or ineffective. Prime Minister, in his Man Ki Baat address, highlighted AMR as one of the biggest health threats India faces. And this concern is absolutely valid. The article clearly points out the main culprit behind AMR: irrational and excessive use of antibiotics. This includes our day-to-day activities, our reactions to medicines. We used to self-medication, buying antibiotics without prescription, using antibiotics for viral infections like cold or flu, not completing prescribed doses. Many people believe antibiotics are strong medicines for all illness. This misconception is dangerous. India has AMR action plans, public awareness campaigns, and surveillance networks. Yet, the article stresses that awareness without system-level action is not enough. While people are told to be careful, antibiotics remain easily available over the counter. This mismatch weakens the fight against AMR. One of the article's strongest argument is about data and surveillance. India has the National AMR Surveillance Network, NASNet. It collects data from selected hospitals and reports resistance patterns. But the problem is data is limited, mostly from tertiary care hospitals, and private hospitals are largely excluded. Without complete data, India cannot accurately understand how widespread AMR is, which regions are most affected, and which antibiotics are failing. The article strongly argues that private hospitals must be part of surveillance because a large portion of Indians they seek treatment in private hospitals. Excluding them gives an incomplete picture, and urban-rural differences remain hidden. Experts quoted in the article stress that policy decisions must be data-driven, not assumptions. Ramya Kannan reminds us that AMR is a medical issue, a social issue, and an economic issue. Unchecked AMR can increase healthcare costs. It can push families into poverty and burden hospitals and professionals. Environmental factors, poor sanitation, and infection control failures, it also contribute to this crisis. The article concludes that India does not lack intention, but needs a better coordination. important actions to be taken were stronger surveillance systems, inclusion of private healthcare, strict control on antibiotic sales, public education backed by enforcement, investment in research and healthcare infrastructure. Only then India can sharpen its AMR battle. This article builds scientific temper and responsible health behavior. Future doctors, nurses, researchers, policymakers, and informed citizens begins here. Your everyday choices, self-medication, incomplete doses, directly affect public health. This article empowers people to act responsibly. Doctors, pharmacists, educators, administrators, and policymakers must work together. AMR demands ethical practice, data sharing, and accountability. As Ramya Kannan clearly shows that AMR is a slow disaster, but still preventable. The question is not whether medicines will fail, but whether we act in time. With this thought, I conclude. I'm Dr. Nisha and Jacob from Career Guidance and Adolescent Counseling Cell, Alapura. Thank you for listening. And remember, using antibiotics wisely today protects lives tomorrow.